welcome to another conversation. Analicia Patterson is a nurse in Savannah, Georgia, joining me to primarily converse about her nursing career and self check, but we'll also address a few matters in observance of Women's History Month. Welcome, Analicia. How are you?
Good. How are you? Thank you for having me.
I'm pretty good. You are so welcome. I've been wanting to get you on here for quite some time, and I'm glad we finally made it happen.
Yes, absolutely.
Yeah. So look, as I just touched on, Women's History Month. You are a nurse, doing some fabulous things, a lot of aspirations and such. So I wanted to just pose a few questions to you, right? And make it as conversational as possible and hopefully as educational as possible too. And folks are going to see why I said that in a minute. But at any rate, let's go ahead and jump into you telling us a little bit about you, particularly as it relates to your healthcare professional career thus far.
So I started my nursing career after graduating from Valdosta State with my bachelor's in nursing. I started off in intensive care, step down units, and then I kind of transitioned to cardiology, doing telemetry and post surgical work, taking care of patients after they are completed with surgery in the recovery room. And then I went back to school and I got my master's of nursing in family medicine, but I also did a dual program. So I have my acute care nurse practitioner certification as well. So initially did a lot of inpatient experience in the hospital, and now as a family nurse practitioner, I work in the clinic setting.
Nice, nice. So I think this is mostly for my edification. Um, I know you touched on the acute care. I may circle back to that. But first, I'm curious about the acronyms at the end of your name. Family nurse practitioner, is that it?
Yes, that's correct. And stands for board certified.
Oh, board certified. Sounding all
Yes, sir.
official. That's what I'm
Pew,
talking
pew, pew.
about. Absolutely. No, that's great. That's great. So I was thinking too, as a nurse, I mean, you are one of the professionals, right? A nurse who probably have a little experience around, or actually could, I guess, explain what self-check looks like, what it should look like, and so
Mhm.
on and so forth. So, having said that, when you think or hear the word self-check, what comes to mind? What does that look like to you?
So, especially coming from my experience in the inpatient setting, I have seen a lot of people come into the hospital for conditions that could have been prevented had they have done some self-check. So, for women, that means one thing that we talk about most is our bless you, baby. One thing that we talk about most is breast exams. For men, it would be prostate exams. And for gearing towards people of color, we talk about making sure that your blood pressure is controlled. Um, but not only your physical health is it important to do self checks and to check in, but also your mental health to check in and see how you're doing. This is Sage.
Hey, buddy.
Say hi.
Yeah, all right. See, he says I have something to say too. He know a little bit. He know a little something about this self check.
Uh oh, you make a mess.
And by the way, I love this real time family oriented conversation. I this is perfect. This is perfect. So as you were saying, carry on.
Absolutely. So self check is very, very important. I know that it's something that is often overlooked. We don't put enough emphasis on it. So I usually encourage my patients to find a specific time of the month or the year where they're intentional about doing those checks, so that it becomes routine and it becomes a habit because it's so important. But also in those self checks, I talked about a number of things, but that also includes blood sugar checks, um, for those who are diabetic or are pre-diabetic. Checking those things as well are included in that self check to ensure that you are taking charge of your health in addition to what you're expecting for your provider to do. Um, I often tell my patients that they are the most important member of the healthcare team. So when you show up to the doctor's office for them to check you out, for you
Right.
to do your annual exam, it
Yeah.
shouldn't be an exam that you haven't done as well yourself. You should be familiar with your body and the way that your body operates more so than they would, so that you can tell them if there are any abnormalities and be on the lookout for those things.
You know what? Who? Now it seems as if you were like directing that to me. That I received that in a way that well, I guess guilty as charged. I totally agree with the way you put that. And self check should be that because that should be the precursor in a way. We know our bodies, right? We
Mhm.
know the certain feelings and when something isn't right. So it's so important for us to, I guess, remember those things and be able to articulate it in a manner that a healthcare professional would receive it in the proper way.
Right.
Yeah,
Absolutely.
I'm glad you said it that way. I will say. So in terms of folks have excuses. um, we're busy at work, we got kids, there's a plethora of things that are going on throughout our daily lives. So having said that, how would you recommend someone stay on top of their checkups and self-check and such?
So, I often encourage people to use one time of the year, especially for their annual eye exam, a breast exam, a colonoscopy, whatever the case. Pick a certain time of the year that you will ensure that you take care of that, whether it be your birth month. At times, that's the easiest thing to remember because you got to do your tags at that time too. There are other things that are surrounding your birthday that you have to remember. So while you're in the same mind of those things, it's important to try to take care of your health as well because that's very important. Um, we set business meetings with other individuals. We make other things in our life a priority. We have to make ourselves one of those things too.
So Analicia, to switch gears just a little bit, what advice would you give a young nursing professional?
So, nursing is an all encompassing term. It's very broad. There are very many different things that you can do in nursing. So, I would encourage them to get experience with different facets of nursing. There are travel nurses. A lot of people are speaking of that right now in the aftermath and the current situation with the pandemic that's going on. Travel nursing is an aspect. A lot of people hear of med surge nursing. You can work in a hospital, in an office setting. There are even nurses that work at computers, that work remotely at home, on triage lines. There's so many different aspects of nursing that you can go into. I encourage those who are interested in nursing to get familiar with those different areas, get as much exposure as possible to the different areas of nursing and the way that nursing professionals interact with the other disciplines. Um, One thing that I did when I was in nursing school or applying to nursing school was I volunteered at a hospital. And that gave me a chance to get a bird's eye view of how nursing staff interact with the doctors when they're on the floor, how they interact with patients' families when they're discussing matters with them,
Mhm,
other professionals such as respiratory therapists,
mhm.
physical therapists. How does that look when all of them are working together? And what are their duties actually? I know one of the things that I did not know that nurses were responsible for
Uh-huh.
was making a bed with a patient in it. I was
Ooh,
mind blown the first time that I was tasked with changing a bed and rolling a patient, changing the sheets while the patient was in there. But
that is
there are
interesting.
patients that are bedridden and they need clean sheets.
Yeah.
So simple tasks such as that, you don't want to be blindsided by all the demands of the job when you
Yeah,
have the opportunity to get familiar with what those things are ahead of time.
absolutely. Yeah, that's a great point. It's nothing like and that's like you said, kind of prior to OJT. No, that's being preemptive, early on. Like you said, just
Hmm.
just to expose you to certain things that if you weren't in that setting, you would never think about or consider. You know,
Right, absolutely.
I can only imagine, like to your point in that recommendation, which is an awesome one, would expose you to so many other inner workings
Yes,
in and around the whole operation of
absolutely.
caring for patients in that type of environment.
Hmm.
I'm gonna switch gears again.
Okay.
Since it's National Women's History Month, I am wondering, is there any trailblazing woman you like to spotlight, um, that may have been in and around the healthcare field?
Absolutely. So, um, Harriet Tubman, very big name. A lot of us are familiar with her story as an abolitionist and her integral part in um, taking slaves that were in the South and bringing them to the North on the Underground Railroad. But during that long and tiresome journey, she was also giving aid to these people, medical aid to them as she transitioned them from the South to the North. And in her later days, she also opened up a home for the elderly and other slaves. And she also served as a nurse for the Union soldiers. So a lot of people aren't familiar with her role as it relates to nursing, but she had a great big part in caring for soldiers and those slaves that she helped to transport. And that's very inspiring to me because caring for people and advocating for people is my passion. So that was a firsthand example of how we can see that having been done and not even spoken about. And she didn't do it for the accolades.
Wow. Yeah. Wow, that is amazing. Now, you just hit me with one then because I had no idea. She was, and when you think about Harriet Tubman and what all she did, it's like, why not? If there would be any profession as we know it today, nursing would definitely fall within her wheelhouse of expertise.
Absolutely. He's like, I need some more of a snack.
See, that's what time it is. That's right. It's like, hey, I'm over here blazing trails too, but I need my vittles first. Uh,
If I'm gonna do anything, I
yeah.
gotta have my energy.
So I wanted to ask you about that was great. I wanted to ask you about your healthcare related aspirations in the near future. Do you care to expand on any of that?
Sure. So, exactly what discipline of nursing, I'm not sure yet. I'll be candid about that. I'm not exactly sure
Okay.
what area of expertise I expect to have, but I know that I do want to, like I said, I take my job as a patient care advocate very seriously. And I want to empower my patients to be informed and know what all of their options are and help them to come to the right conclusion of what path they want to take for themselves. Um, I was doing a little research and I was looking at the statistics for nurse practitioners. There are actually 6.5% of all nurse practitioners that are identified as Black or African American. 6.5%.
I had to bring myself back in on that.
6.5%. And so, one of the things that we learn while we're in nursing school
Oh,
is to be culturally competent.
yes.
That means identifying with what um, best serves an individual based off of what their cultural beliefs are, their religious background. Be cognizant of those things so that you can tailor their care specifically to what their needs are.
Mm.
so that they can thrive essentially. And I see that there's disparity there in healthcare. I don't feel like enough of us put um, the due effort that that area of cultural competence deserves. So I envision being able to help make that a greater focus somehow in healthcare. I'm not exactly sure how, but I know that that's my calling.
You know that that's your calling, right? Man, that that statistic is glaring. I mean,
Yeah.
that's I've heard of some numbers in certain professions before, and I mean, quite frankly, I would have never guessed, knowing, and it's crazy knowing as many nurses as I know. You know my cousin Jennifer,
Yes.
a couple others. I know a lot of black nurses, right? So
Mhm.
the optics, the picture in my head is
Yeah.
there are a multitude of them, and I guess there are a multitude of them at the RN level, right? That Bachelor of Science in Nursing. Correct me if I misspeak.
Yeah, that's correct.
Yeah, yeah, but having that next level of mastery, if you will, that comes with other certifications, yeah, that stat is alarming to me.
Yes, absolutely.
What does that crosstalk look like? I'm just curious.
So that is definitely something that needs to happen in a greater way.
Mm,
I do encourage those who are seeking nursing or those that are in nursing school to have some type of mentor. Um,
mm.
and if there was some type of program or national database to make it easier for people to connect in their own cities, that would be fabulous. I know I am personally a member of the National Black Nurses Association, and so I'm also a part of the local Savannah Black Nurses Association. And that is a way for us to have nursing students, nursing professionals, and those that are have their bachelor's of science in nursing, for us to have all of them collaborate and to share their skills and things of that nature. But you brought up a great point. I think that there should be a greater way for that crossover to happen.
I tell you, I keep switching gears on you. Keep you on your
I'm
toes.
following, we're ping ponging.
There- and you're serving it back. So here's the thing. One of the last questions that I want to ask you is it's going back to National Women's History Month, but moreover, from I know you just shared Miss Harriet Tubman. It's more aligned with your profession. Another lady that inspires you.
So I have always been enamored by Shirley Chisholm.
Oh,
She was the first Black woman to run for Congresswoman and be elected to that position. But she is also monumental for running for president as the first Black woman, female, um, to run for president in 1972. She has a saying that she says, we must reject not only the stereotypes that others have of us, but the ones we have of ourselves. And I know that mental health is something that we are starting to put in the forefront a lot more currently. But I think it's um, very eye opening that she said something such as this at that time, even though all those many years ago, because it speaks to the fact that we have to be cognizant of what our self talk is. How do we communicate with ourselves? What things are we believing to be true about ourselves, in addition to what we believe about what others think of us? So, especially with what we just discussed, I think it's so important representation, breaking down those stereotypes, knocking down any type of barrier that's placed upon you. So Shirley Chisholm was definitely the epitome of just that.
wow. I tell you that, yeah, Shirley Chisholm. that was, as we would say sometimes, she was a bad mamma jamma.
Oh yeah. Oh yeah.
But
She even said, there was another quote by her that said, if there's not a seat at the table for you, bring up your own folding chair.
oh, see, okay,
So
that's a
she
new
was a trailblazer in her own right. If there is not room for you, space for you, you create that space yourself.
that's a new one on me. I absolutely love that. Oh
Hmm.
boy, when you finish that one, I was feeling a little something like right here. That's, oh boy, I need
Yes.
to further investigate that to see where that came from. But
Hmm.
wow, yeah, that is an awesome quote, and I love quotes, by the way. They say so much with so little, you know,
Right.
and they're typically, for the most part, most of them are fairly easy to remember. Um, but no, that's one I have yet to hear, but I would definitely add to my repertoire.
Hmm.
Absolutely. Wow. Hmm. You got me with that one. I'm going to get ready to close this thing out. Um, and I guess I kind of want you to just quickly piggyback on an earlier question that I posed with respect to it inspiring and motivating a young nurse or what have you. But for just a young person aspiring to venture into the nursing, but I'm sorry, but the healthcare profession in general, like what parting words would you share with her or him for that matter?
Yes. So stay encouraged. Um, Pursuing nursing, taking that step in itself says a lot about your character, the kind of person that you are, and um, your selflessness. I can't say the number of patients that I have cared for in my time thus far in my career, but I do know that I've gone into it thinking that I'll treat each person as if they're a family member of mine. So going into nursing is to be applauded in itself. It's a long journey to get through nursing school and obtain everything that you need in order to start practicing as a nurse. And there are times where you will doubt yourself along the way. You will have hardships along the way, but it's worth it. You're able, you're capable, and people that you don't even know are in your corner surrounding you, um, congratulating you, cheering for you. And if you ever need help, don't hesitate to reach out, because it is a profession where people have done it before you, and they're willing to help. So I really do encourage others to find a mentor, and it never hurts to ask.
I was sitting here the whole time like, yes, absolutely, check on that one, and so forth. And I know it's going to resonate with others in the same light. So I really appreciate you breaking that out and down like that. Analicia, thank you so much for joining me and just sharing these words, giving us this all of this background information, the historical references. Like I said, her Pittman, I didn't have a clue that she was anywhere near in the nursing
Yes, yes.
field. Thanks for also sharing us with your little boy.
Little sage.
Yeah, yeah, awesome, awesome timing. Hey, buddy. Yeah, he's like, I want to say goodbye too. What? Okay, he was coming to get his stuff. But look, thank you, Analicia. It was a pleasure having you on. Thanks again for imparting these words. Okay,
Thank you so much for having me.
absolutely, anytime.
You gonna say bye bye?
Oh,
Bye bye.
there we go, buddy. It's good seeing you on here. Thanks for helping us out, man. All right. Well, everyone, look, that was Analicia sharing a wealth of information with respect to nursing, self check, and offering a lot of historical information and references that ladies that have inspired her, shoulders that she stand on to this day. Again, I thank her so much for sharing that information with us. So, as you guys always know, you can like us on Facebook if you've yet to do so. Follow us on Instagram and subscribe to the YouTube channel. Thanks for your continued support of Life Writing, where Writing Speaks.